Hello, I am Dr. Megan Lander from Johns Hopkins Department of Gynecology and Obstetrics, and I present to you our study entitled Predictors of Sexual Health Quality of Life After Hysterectomy and Sentinel Lymph Node Mapping for Endometrial Cancer. To start with some background, lymphadenectomy has been an important part of surgical staging for endometrial cancer. However, it has been problematic due to its risk of lymphedema, which can result in impaired quality of life for many patients. In order to reduce the rate of lymphedema from this procedure, sentinel lymph node mapping has emerged as an acceptable alternative to lymphadenectomy with less morbidity. While it is known that lymphadenectomy has associated risk and can lead to decreased quality of life, there is a lack of data regarding the impact of sentinel lymph node mapping for endometrial cancer on women's quality of life, and more specifically on outcomes of these patients' sexual health, satisfaction, and functioning. This study sought to characterize sexual health-related quality of life and patient-reported outcomes in women who have undergone hysterectomy and sentinel lymph node dissection for endometrial cancer, as well as to determine demographic and symptom-related predictors of sexual satisfaction. We looked at patients that were seen in our GYN oncology clinic for outpatient surveillance visits following hysterectomy and sentinel lymph node dissection for endometrial cancer, who had surgery from January 1st, 2015 to December 31st, 2019. Patients that agreed to participate in the study completed 2 validated health-related quality of life and patient-reported outcome surveys adapted from GOG 244 protocol. We gathered demographic and treatment data from the medical record and generated summary and inferential statistics. Table 1 shows our baseline demographics and summary statistics. 70 patients completed surveys, and the median age of the participants was 61. 54% of participants identified as white, 23% as Black, and 7% as other. 6% of patients had positive lymph nodes, and 90% had grade 1 disease. Adjuvant treatment was given to 20% of patients for high-risk findings. 51% of participants reported they were satisfied with their sex life, and 30% reported having had sex in the prior 30 days. 78% of patients reported little to no pain with intercourse. When compared between groups, 50% of participants who reported being unsatisfied with their sex life also reported pain with intercourse, while only 19% of patients that were satisfied with their sex life endorsed pain with intercourse. While not statistically significant, more participants who were unsatisfied with their sex life reported pelvic pain, 44% versus 19%. 25% of patients endorsed at least some fear regarding sex, and this was not significantly different between groups. 25% of patients reported lower extremity swelling. However, presence or absence of swelling was not significantly correlated with sex life satisfaction. 96% of patients reported being somewhat to very much satisfied with their overall quality of life. In conclusion, sexual satisfaction after hysterectomy with sentinel lymph node dissection for endometrial cancer is impacted by the presence of pain with intercourse. However, it is not associated with the presence of lymphedema. An overwhelming majority of patients that have undergone this procedure report a high quality of life. Given the high rates of long-term survival in these patients, addressing dissatisfaction with sexual function represents an area of opportunity for intervention to improve sexual satisfaction and overall quality of life in endometrial cancer survivors. Thank you.